We're at the IAS meeting in Vancouver, BC, and we're here with Sheri Lippman, Assistant Professor, Center of AIDS Prevention Studies at UCSF, and Tim Lane, who's also Associate Professor at Center of AIDS Prevention Studies, UCSF. We appreciate the both of you coming in to talk with us today, and to give us the opportunity to understand what you're doing in a study in self-testing in South Africa.
Right.
Yeah.
Yeah, so self-test kits are one of the newer technologies available right now for us to try to increase the number of people who get tested for HIV. And these are kits where you can actually go into a pharmacy, at least in the United States and the United Kingdom and some other countries, and pick them up yourself and take them home and do your own diagnosis, either with an oral fluid test or a blood-based test. You just prick your finger. You get to read your own result in the privacy of your own home or with your partner or whoever you're with, and you can then seek care. So it's an exciting way to try to reach people who really don't want to be going into clinics to get tested.
So how do you negotiate this? So basically these tests are given out automatically, or how are they distributed?
Well, okay, so it depends on what country you're talking about. In the US, they're over the counter at Walgreens. You can go in and buy them at a pharmacy, and they're usually $40 to $45. But there are plenty of studies and some initiatives going on in some of the cities where, more urban cities, mostly places like Los Angeles, they will actually let you order them online and send them to you for free. So we're looking into different ways to distribute these tests in other countries. I think it's still something that we're trying to figure out. How do we best get these test kits, particularly to the people who need them the most, make it easy, accessible, so that those populations that really don't want to be in a clinical environment can have access to testing.
I was just going to say, one of the reasons I'm excited to work with Sheri in South Africa on this project is because I've been working with men who have sex with men in South Africa for over 12 years, and one of the biggest unknowns is how do you get a community that has experienced so much stigma and discrimination in the healthcare sector to actually go and use HIV testing services. And what we found is that even when you can provide training for healthcare workers to be a little bit more sensitive to the human rights of people who are different from themselves, we're working in small communities where there's a real fishbowl effect. And so even though you're going to get the kindest, most gentle and human rights respecting nurse, it's probably your sister's best friend. And so a lot of guys are really reluctant in the communities we're working in to go test in that kind of environment. So self-testing really is an important option for them to be able to find out their HIV status.
And how do they find out about the test? Is it like, is it word of mouth, or is there promotion somewhere? Right.
Well, in South Africa, it's
a little of both.
Yeah, in South Africa, it's an interesting case because there's no regulation on self-testing, so there's no legal status, and some manufacturers have just put HIV test kits that aren't packaged for self-use on the counters, so people can walk in, buy it, and take it home. But what we're doing right now in our study is actually enrolling men in research and giving them 5 test kits, and they get to choose whether they want an oral test kit or a blood-based test kit. And we're asking them to, use those tests and also use them with their partners or their friends, whoever needs a test, and sort of see how that goes. So we're distributing them really through social networks right now.
And even recruiting for this study, I mean, this is a study environment. These tests aren't available for self-testing in South African pharmacies or in any other way at the moment. But in this community, I had just completed a separate study where we'd enrolled over 700 guys, men who have sex with men, in a behavioral study. And we randomly recruited for the self-testing study out of that sample. And guys who were not randomly picked to be in the self-testing study came knocking to the study offices and asking, how do I get into this study? Because the self-testing really sounds great. So already, even though we're just a couple of months into the study, we know that there's an enormous demand for this way of testing.
How often do you prescribe or recommend the testing occur?
So with a key population like men who have sex with men, we are promoting at least every 6 months, as well as after a known risk exposure. And so we call that regular testing. Regular testing in South Africa for men who have sex with men has not been particularly good. Probably fewer than 20% on average are testing regularly. The program that we've been working with in South Africa to bump those numbers up, we've now managed to get that percentage close to 60% through a community mobilization program for testing. So we're hoping to see that number go up towards the 90% goal that all countries are now trying to meet.
Right.
So how does this become trendy? I guess that's the best thing, because that's pretty much the way things work in the men who have sex with men, gay communities, whatever.
It's a great question. Maybe you can tell us. I mean, I think one of the things, in different settings, it's going to take something different. I think in the South African setting, I really think that having some community leaders, especially leaders in the MSM community, uptake these test kits and promote them and share them. I think now that people are starting to understand that they're there. There's a lot of curiosity, and so we need to capitalize on that and really, sort of forge this interest in increased testing uptake. But I think at the same time we really need to work on destigmatizing HIV in the community, because the last thing we want is for people to start asking each other to take test kits and then wanting to know the answers and having this sort of uncomfortable disclosure happening. So it's really something that has to go hand in hand with stigma reduction at the same time that we're really promoting testing uptake.
Do you tie in with any treatment settings and so forth? And
Sure, you want to talk about that?
Yeah, sure. We so our research is sponsored by the National Institutes of Health. We have been working with an NGO in South Africa called the Inova Health Institute, who are renowned throughout sub-Saharan Africa, in particular in South Africa, for their work at expanding non-stigmatizing clinical services for men who have sex with men. So we are able, in the context of our study, to refer anyone who wants services, particularly those who are positive and need to be linked to care immediately, into clinical sites that Inova has trained and actually has staff working in. They're public health sites, so it's as if you walked into any clinic. There's not a special or exorbitant fee that you have to pay.
It's free.
It's free, but they're able to get non-stigmatizing healthcare if they need a CD4 count, if they need to pick up antiretroviral medication. So that's the kind of environment I think that Inova and other stakeholders in South Africa who are working with men who have sex with men are trying to promote as the national standard of care, and I think that is the right way to go.
so a non-specific HIV and AIDS location, it's more of a general, so when you walk in the door, you're not labeled, oh, that person must be looking either to take a test or dealing with something with HIV.
That's correct. They walk into the door and they, tell they tell the receptionist why they're there. They'd like an HIV test. But guys who are going to take advantage specifically of the Inova-sponsored services know who to ask for. And the clinic staff are aware that people will be coming and asking to be referred specifically into the regional leadership site, the RLS site that they're looking for.
What are the next steps that you and the project would take?
Well, we need to analyze our data. So we've enrolled at the South Africa site 125 MSM, and they're currently giving out the test kits. So they'll be coming back into the study site, and we'll be asking them about the acceptability and the utilization of those test kits and who they tested and who they gave the test to, and if they were positive. Yeah, we're looking to see if testing frequency increases, if testing uptake increases, if people are detecting virus earlier. And we're looking at how they link to care if someone has a positive test. So as part of the study, we requested sort of permission to call them and see how it goes sort of in the future. So we'll be calling them to see if they have a positive test, whether they actually got to a clinic, and helping them get there if they haven't gotten there yet.
How quickly is the test analyzed?
It takes 20 minutes on the oral fluid test and 15 on the blood test. So it's very quick.
But they can do either one.
Yes, what we're doing is we're showing them both options, and then they're going to choose one and take 5 of those home with them.
Are there any people that you can surmise are evaluating them and their, themselves, but for their friends, or their friends for themselves, that determine am I having unprotected sex with somebody here who is negative or positive or whatever? It seems like it seems like an easy route to become very careful about how you have unprotected sex.
Yeah.
Right.
So there's a little bit of controversy around that because these tests, have sort of they have the same window period that you get with a regular test you would do at a clinic. They're not antigen tests; they're antibody tests. So there's a little bit of worry in the community that if people test each other and they find out that they're negative, that they'll have condomless sex, and then you could transmit the virus if you've had a recent exposure.
Right.
Although
It was within the window of safety.
Yeah. No. Well,
Yeah.
if it's in the window of safety, then you're safe.
Yeah, but I'm saying, what is that period of time that you can say, okay?
They say up to 3 months, but
Oh, really? Okay. All right.
I think most people
Yeah,
would
'cause
show up as positive.
so they should
before.
understand that's part of, explain to them, right? That's
Yeah, it's part of
Yeah.
community education around these test kits. I mean, and it's no different than when you go to a clinic and you get tested.
Yeah.
It's just that at that point the counselor talks to you about the window period. With these kits, we're hoping that community education sort of can play that role, that people will understand that. It's also written, of course, inside the test kit, but people don't like to read the instructions.
I
So,
know. Yeah.
I mean, who likes to read instructions?
Right.
But yeah, there is a good chance that people will use these for sexual decision making.
But I also don't think that's a bad thing. Part of sexual decision making is, do I know the status of my partner? Well, now you might.
Yeah.
And as a result of knowing the status, do I engage in sex with a condom or sex without a condom?
Yeah.
I mean, so it gives people more information to make decisions.
Right.
And these are, to be very clear, these are high prevalence and high incidence communities. Condom use isn't great at the moment, and what this provides, what the study provides, is another opportunity for counseling to reinforce safer sex messaging.
Right.
And the community program, Project Boitato, that we are embedding this in, is also another opportunity for that. So we're really not only increasing people's options for testing, but increasing the number of ways they can get HIV prevention messages.
Exactly.
And also, you must, like you said, there's a high risk community. So do you kind of give them the sense of what the risk is in this community? I mean, do you say that?
I mean, we've been working, NOVA and UCSF have been working in this community for 6 years now. And they are really good about sort of factual knowledge. They have wanted to know every step of the way. What have we found in the studies? What is the HIV prevalence? What do we do about it? So we have a very good line of communication with the community, from research to the community. That's something that I, as an individual and at UCSF as an institution, is really good at and values, is making sure that those lines stay open, because the knowledge is not useful unless the community has it.
Exactly. Yeah.
So I just want to make sure we covered everything that was important to you, because if it's important to you, it's probably important to our audience, because that's who's learning about this. Is this something we would deploy in this country? I mean,
So it's over the counter here.
Yeah, but I mean, is it something you would deploy in this way, through
Yes, in
freely
fact,
and so forth?
I do have another study that's underway right now in Alameda County, so Oakland area, where we're actually training men who have sex with men of color in the area to learn how to use these test kits and then take them to their friends and test them through their social networks also. And again, this is people who don't want to be tested, and it's hard for testing. It's hard for clinics and people doing outreach to find them. So they find each other, because this is part of their social networks. So we are distributing through social networks here, and there are other groups at UCLA and other areas that are distributing through dating apps like Grindr. And other social media sites.
We made a little bit of a faux pas. We keep on referring to here when
here,
we mean
right? We're in Vancouver. Sorry.
We're in Vancouver, but
I'm sure
if we know
Canadians
what
love
we
that.
mean the U.S. Right, exactly.
In the
Canadians
US,
don't
yes.
like that. But,
Thank you.
But they copy a lot of what we do, and I guess we copy some of what they do. And
Right.
We could copy more of what the Canadians do.
I know. This is what I was saying. Self-deprecating on that one. Yeah. Well, I appreciate you doing the work that you're doing, and I hope that we can learn more and understand if this is a viable route, a better or viable route for our community in Oregon or Washington or California or
Sure.
the rest of the country.
Sure.
Because it's important to have options for people, and whether it comes through a support group or whether it comes through Grindr or wherever,
Yeah.
it's important to get this stuff out for the people and take it in the
Sure.
way they want to. And also by getting referred to by, like you said, people who are, leaders in the community to get that message out that this is something I'm doing, you can do it too.
Right.
Absolutely.
Right. Thank you very much, Sheri.
Thank you.
Thank you very much
Thank
for the
you.
opportunity
Yeah,
to
yeah,
talk.
sure.